there, I am Kristen Richmond, the Volunteer Engagement Manager with 365 Health. First, I want to say thank you for volunteering for your local community health fair. This resource is important to get so many Coloradans access to preventive health resources, so thank you so much for taking the time to be with us today and learn more about your position. So this video is for the colon cancer education area of the health fair. Now this station will be set up in the on-site registration area. So the area of the fair where participants have gotten their on-site paperwork and they're sitting down to fill it out. So you as a colon cancer educator will be responsible for kind of mingling and going around and talking with the participants about, colon cancer risk, colon cancer education, and whether or not it's advisable for them to potentially get screened today. Early detection really does save lives, especially with colon cancer. So when you get to your station, there's going to be a protocol. Please review it. There's some important highlights, a couple new additions here that we've added. Really, just this language is for you to be aware that also in the registration area will be who we call medical registration educators. So you and the medical registration educators should work hand in hand to support participants in choosing which screenings are right for them. So in your protocol and on your table should be a kind of quick questionnaire on colon cancer. So you're going to have the participants look at this. There is also Spanish. At your particular site, they may have copies of this. So in that case, you could give each participant a copy of it, have them write on it. There should be pens near or at your station, or at least on the tables where the participants are filling out their paperwork. Or you can just hand it to them and say, let me know if any of these questions you have a yes answer to. So it just walks them through basically age, family risk factors. So you as a medical person at the station or someone with deep knowledge of colorectal cancer should be able to help them determine their risk through this questionnaire. So if they get through this questionnaire and they've answered yes to one or more of the, I believe, 3 questions that are on this sheet, you're going to want to talk to them today about getting a colon cancer screening kit. So at many of our health fairs, and please ask your site coordinator, or if there's a 365 Health staff member there, ask them if we have any vouchers to give out colon cancer screening kits for free. We do have a current partnership with the CU Cancer Center, and we're working to get out free screening tests to communities, especially communities that are either underserved, they have inequitable access, or they're a part of a minority group that has a higher risk for colorectal cancer. We want to make sure that we are getting these out to the people who need it. So if your site has vouchers, please utilize them. So anyone that meets those criterion that I just explained, you're going to want to work with them to fill out this colon cancer screening kit voucher. So on the front, it just explains a little bit about the test, what it is. The cool thing about our partnership with the CU Cancer Center is that if a person is a part of the groups that I just described and they do have a positive result on their colon cancer screening kit, meaning they do need follow-up care after having this screening, then the CU Cancer Center is going to help provide that follow-up care to those participants. So this is a really cool opportunity, and we want to make sure that we can get this to as many participants in need as possible. So part of the follow-up process is that we need their information and their consent to allow us to share that information with the CU Cancer Center so that way they can contact the participant to help initiate that follow-up care process. So on the back of these vouchers, there's some information that we need from them. There's a little consent language here so that way they know exactly what they're consenting to. This is their personal health information, so we want to ensure that they are completely informed and that we are following HIPAA guidelines at all points in this process. So have them fill out their name, the age is on here, or their birthday. They're gonna sign, you're gonna sign as a witness, and then once they filled out legibly all this information on the back of this voucher, you are going to hand them the voucher. And then if the kits are at your table, the colon cancer screening kits, they come in these boxes, and there's 10 envelopes within each box. So please be careful not to give them the whole box. It's a box of 10, that's a lot of colon cancer screening kits. So you're gonna hand them the voucher, you're gonna hand them the screening kit, and they're gonna take this with them, and the voucher will be processed at the cashier station. They're gonna take this voucher, they're gonna take this home, and they're gonna send the sample in to Quest Diagnostics, and then they'll get their results from there. So this station is really important. Please be sure that you, as you're doing this station, are, even if you're not naturally extroverted, just, jump out of your bubble a little bit for the day. Make sure you're really mingling and going up and talking with participants, because sometimes they are just overwhelmed by health and the health information and all the things that they need to know. And so you're really there to be their resource. So I want to make sure you feel comfortable to jump in to be that resource for participants, whether they're coming to your table or you're going to their tables to interact with them. And ultimately, thank you so much for volunteering at the health fair.